Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, our guest is Professor Daniel Dawes, author of a book entitled The Political Determinants of Health. Professor Dawes is the executive director of the Sacher Health Leadership Institute at the Morehouse School of Medicine. We discuss the role of politics in health, both to understand the problem of inequity and to take action. Let's listen. Professor Daniel Dawes, thank you so much for joining me on Public Health on Call. I'd like to ask you what your starting place is for introducing the concept of political determinants of health.
Well, Josh, thank you so much for having me on. When I think about the starting point, for me, it starts, at the inequities that many people are experiencing or we've, observed in our society. We know that many racial and ethnic minorities, people with disabilities, lower socioeconomic status individuals, LGBTQ plus individuals, and many individuals living in rural and frontier communities across the nation die disproportionately each year. And of course, the toll that it's taking is unconscionable. But one of the things that I always think about is that here in this country, the nation's health is not an organic outcome. It is not an accident, right? That we see higher death rates among Black and brown communities and other groups, or that, we see worse health outcomes, right? Higher rates of diabetes in one group, or mental health inequities, higher rates of depression or anxiety, et cetera, in one group versus another. And so I think about, why this is happening. And that's where it starts for me.
Why is this happening?
Yeah, why is this happening? Why have they been happening? Why do we continue to see the same statistics over and over and over again, right? Over the course of the history of this country. What's really driving or fueling those inequities? And I know a lot of us have really gotten our arms around this concept of the social determinants of health, and I think with very good measure, right? And so when we think about the social determinants of health, they forced us to think outside of a clinic or outside of the walls of the doctor's office or a hospital or a health system. What exactly really has played an outsized role in these health inequities that we observe in these population groups? I think we're going to understand the fundamental drivers, the fundamental determinants or causes of these health inequities downstream.
So we start with these inequities in health outcomes in matters of life or death. And then you say, well, one of the causes for that is that people have different experiences in their lives. Some people are homeless and other people live in, totally adequate and great housing. Some people have no access to food, to nutritious food. Other people can go to the supermarket and get whatever they want. Some people have jobs that put them at high risk for injury. Other people have jobs that, don't in any way do that. So when I think of social determinants of health, it's all of those factors. And so some people say, well, that's the explanation. That is why we have these big differences in health outcomes.
And I say they're absolutely right. And now let's talk about how these social determinants of health, right? As you mentioned with transportation issues or housing issues or education and the lack thereof. How did those come to be in the first place, right? So I would assert that through a political determinants of health framework, we can identify, we can plan, we can implement the strategies to counter the negative consequences of the social determinants of health that have generated the very conditions that give rise to these inequities. So when I think about it through a political determinants of health lens, we can trace the paths backward from the well-documented disparate health outcomes that occur downstream to their origins that sit upstream, and then ask ourselves what actions or inactions or decisions created and perpetuated these starting points.
So I want to understand this concept of political determinants of public health a little bit more. We agree that there are these environmental, social factors that are incredibly important in health outcomes. And I think what you're saying is there are reasons why these environmental and social factors and inequities have developed over time, and we have to understand them for us to be able to understand why the health outcomes are different.
That's exactly right. So, when I think about the political determinants, we know that they affect everyone because they encompass the systematic process of structuring relationships, distributing resources, and administering power. However, there are stark differences in how negatively or positively they affect certain individuals and communities. So as an example, right, we talked about transportation earlier. When a transportation policy, for instance, removes a bus route that runs through a community with which residents heavily rely upon, right, for affordable public transportation to get to their healthcare appointments, to get to their school, to get to their places of employment, the individuals and families living in that community suffer from a negative political determinant that creates an inequitable resource distribution of public transportation services, right? So once those policymakers made that decision, for instance, to remove the bus route, now we have to think about the domino effect on these individuals who relied on it. So for those of us who work, let's say, in community health centers or in health systems on the healthcare side, we've seen some forward-thinking efforts to launch programs to pay for taxis and or ride shares, right, to bring people to their appointments or to bring them to the locations that they need to get to. However, I think such efforts, while they're effective in their immediacy, they're only treating the symptom, not the root causes of the problem. So when such an affected community comes together now to advocate for themselves, right, where they gather momentum by convincing more individuals or businesses in their communities, community members and organizations to join their effort, and when they succeed in getting their bus route reinstated, these folks have now understood the chance to restructure the relationship with the transportation authority. And they've essentially exercised the power inherent in understanding and addressing the political determinants of health. Does that make sense?
I think I'm getting it. I really do appreciate this because it's sometimes said that, like, look, there are transportation disparities that are important for health. And then that's it. There are just transportation disparities. You're asking, why did those transportation disparities come about? Because to understand that is to create an opportunity to undo them.
That's correct. Think about it this way, right? These political determinants of health inequitably distribute social, healthcare, or other determinants. And they're what really are creating the structural barriers to equity for these population groups who lack power and privilege, especially in our society.
There's the P word, political, in the political determinants of health. And a lot of people get nervous as you approach the P word because it means, perhaps touching the third rail of electoral politics.
Yeah, I know a lot of people definitely get nervous when you say the P word. And that is unfortunate. This is not meant to be a partisan framework, but it is one that whether you are a Democrat or Republican or independent should be able to leverage to assess once a community has identified an inequity. Essentially, the framework helps them to understand the levers that have been pushed and pulled over time, right, to either maintain the status quo or to change the status quo. So what we have found, Josh, is in this country, in order to advance equity or egalitarian policies, you usually have to understand that at the federal level, these policies have never been advanced with just the moral argument alone. For those, who are mental health champions like myself, right? I'm a mental health equity champion. And it's so frustrating to read the history in this country of how long it has taken mental health reformers to get policies that would elevate mental health in health policy, right? And that would drive the investments that we need to increase access to behavioral health services, interventions, programs, and supports. So once we've recognized that you can make the moral argument till your tongue bleeds, and that's never going to be effective, we need to ask ourselves, then what would be effective? What would help us to advance these health equity focused policies in our community?
So what would be effective?
I think it's important to have some political acumen. You need to understand, the decision maker, that policy maker, and where they may lean from an ideological perspective. I think it's important to understand how you can tie whatever policy recommendation you have to that particular agenda, right? How do you get this to work? And in this country, what we have found is that when you show or demonstrate, right, the investment value to the government, right, when you are able to understand the influence of the commercial interest, those are the policies that have been able to go over the finish line.
So part of being a health advocate is understanding where commercial interests are weighing in, what they're thinking, and being prepared to counter that if necessary.
Oh, my goodness, absolutely. And I have a really good case study that I just wanted to share with you. And it's in South Los Angeles. In South Los Angeles, my dear friend, who is no longer with us, Lark Gilloway-Gilliam, she had mobilized the community there of largely African Americans and Latinos to say, listen, we're tired of living in these food deserts, right? And food swamps. And we want healthy, nutritious, fresh fruits and vegetables and meats and fish in our community. And so they worked, right, without the commercial interest, thinking about that piece. They worked with their policymakers, right, their commissioners and council members and mayor, and they were able to get this ordinance preventing additional fast food restaurants from coming in. But then they were shocked afterwards when, new or fresh fruits and vegetables and opportunities to do, to bring those healthier food options into their community didn't materialize. And after a few years, they realized, oh my goodness, we needed to have done something to really incentivize these commercial interests to come and invest then in the community, because the government did its part. But what about then getting these businesses to come in and operate and make it so that it would be a profitable enterprise for them? That's what they noticed, and they were unsuccessful because they had not thought about the commercial interest piece.
Now, your book came out during the pandemic, and I imagine you've done many a Zoom talking to people about it. And our listeners, I'm sure, are certainly aware of the deep inequities that exist in health in this country and the strong moral case, for fixing them. You're now telling people that's not enough. You need a moral case and you need a political case. You need to understand the history, understand the policy environment, and be savvy about the kinds of things you put forward. How is that message being received?
I will tell you that it depends on the audience, right? I remember Congressman John Lewis, when we were discussing the book and we were discussing the main points in the book, and I made that very point that you just did, and it upset him, right? Because he's such a pacifist. And he says, that shouldn't be. But then he admitted, well, not all of his colleagues subscribe to his beliefs, right, of pacifism. So he says, you know what, that's a really compelling point. And I've noticed that with others who are similarly minded, right, to Congressman John Lewis and his worldview of the moral argument, that should be sufficient. But they all understand, I think, once they've been their conscience has been shocked a bit by that revelation, you then see the wheels are turning in their minds. And so more and more folks have said, you know what, my God, no wonder we've been trying for decades to get this ordinance passed in my community, and it's just fallen, on the wayside. It's been ignored.
Professor Dawes, you're making a very strong case that the political process, the democratic process, is incredibly important to improving the social determinants of health that drive whether or not people are healthy. But the political process and the democratic process are under a lot of strain in this country now. Is part of what you're saying that these are issues not only for our democracy, but looking forward also for our health?
I do, and I totally agree with you. Voting is a major component of the political determinants of health, because voting can mean the difference between life and death for these very communities that tend to experience the greatest inequities. And yet they're oftentimes the ones that are prevented in many cases, right? Or they experience barriers to voting, right, than other population groups. And so is it any wonder then if they aren't able to engage in the political process, if they're not able to participate in civic engagement opportunities, why the policies don't reflect, these communities' needs, right? And they haven't aligned the resources. These social and economic policies haven't aligned the resources that are needed in these communities, not only to survive, but thrive. When we talk about redistricting, when we talk about gerrymandering, when we talk about voter suppression tactics, I live in the South. Obviously, that is something that is very sensitive to me, because you can see then how there are forces that are trying so hard to prevent people from exercising their constitutional right to vote. And that then is going to have significant and continued implications moving down that will continue to harm their health and lower their life expectancies moving forward.
Professor Dawes, thank you so much for joining us on Public Health on Call.
My pleasure. Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.